last decade, homelessness in California has grown more than 22%. The majority of our homeless population in California and in LA County are unsheltered. This actually represents over half of the homeless population in the nation. They face more significant health challenges, violence, and trauma. You have to appreciate that the homeless are not homogeneous, they're not the same. In particular, both Black people and Native populations are overrepresented in California homelessness. And that has important implications, again, for how we assess risk and how we craft policies. In LA County, there's 30% of households that are paying more than half their income as rent. So this combination of high rents and low relative incomes is a primary driver to homelessness. There's evidence of systematic and institutional racism, and that's why we see disproportionality among especially the Black population here in LA County. And so you might see the engagement with a landlord providing some level of discrimination, but then there's also history around redlining and exclusionary zoning and so forth. Employment discrimination that leads to higher unemployment rates for Black individuals, and it also leads to lower wages. As the pandemic descended, the two populations that people most talked about in terms of being at risk were those who were incarcerated and those who were homeless, not having the same sort of access to healthy food, sleep, hand washing, social distances, etc. The other kinds of risk factors are that the homeless population is becoming increasingly older. So Project Room Key is a program here in California where the state of California is trying to secure 15,000 hotel rooms that are currently vacant because of the economic shutdown, explicitly for people who are experiencing homelessness as a way to reduce spread and to protect those who may have been exposed. It also provides people wraparound services, and currently, the federal government is going to reimburse state and local governments up to 75%. In some cases, the current shelter system is oversubscribed in the sense that you aren't able to maintain physical distancing unless you actually change the physical infrastructure of those shelters. So you have heard about the city of Los Angeles converting up to 42 rec centers into shelters. They've also extended the winter shelter program, 300 new mobile hygiene stations and 18 shower facilities. One of the big concerns, given the fact that newly homeless are typically driven there because of economics, we have this economic shutdown. We have seen action at the city and at the state level where people have enacted moratorium on evictions and foreclosures of various kinds. There have been other sorts of provisions around rent control, but again, what's going to happen when COVID-19 is done? These issues around systematic and institutional racism that is a key driver to people becoming homeless. What are we going to do as a community to make sure that people can be moved to permanent housing? Oftentimes, policymakers are focused on the immediate because the crisis is so real and immediate. But a group of us ought to be thinking about what happens 6 months, 12 months, and 2 years from now.